First of all, thank you for the possibility of sharing our experience on clinical practice guidelines. Obviously, I'm talking on behalf of all the network and all the EPAG in the network, since we had a lot of work on clinical practice guidelines. Obviously, a lot of work is still to be done. But I will try to summarize our experience, and I will share the discussion together with Diana and Ilaria in order to highlight some aspects of the work, the very huge work done also by EPAG in the network. So try to summarize in our story on clinical practice guidelines. I'm trying to present to you a sort of journey in which we start our work on clinical practice guidelines, consider which kind of clinical practice guidelines do we have in our field of disease. ERN ReCONNET cover rare and complex connective tissue disease. So our thoughts were, okay, we have clinical practice guidelines, but let's check a state of the art on what we have. So at the beginning of the ERN launch, we started this work performing a real state of the art. And we summarized it together with EPAG, since in our network, I suppose it is similar for our other network, but in our network, EPAG and clinicians are the same thing, just different voice, but the same thing in the approach of the work. And we worked on this state of the art, summarizing all the papers that we produced in a supplement published in the journal, a journal of a EULAR journal of our European scientific societies. And in this state of the art, what we collected is what we have for some diseases, and think about the need of adopt, and this is obvious, the clinical practice guidelines that we already have, and think about the need of adapting some of our clinical practice guidelines. But our state of the art highlighted, unfortunately, that for some rare diseases, this is especially for some rarest disease, no clinical practice guidelines exist, since we do not have the sufficient evidence for producing these clinical practice guidelines, or we have some evidence to be summarized in clinical practice guidelines. This work was very, very important, and since it is a sharing discussion, I will leave the floor to Ilaria in this case to highlight many aspects of the clinical practice guidelines, also introducing the unmet needs by patients. But at the end of my summary, I will give the floor to Diana for summarizing the approach that we use as network in highlights from the methodological point of view, but also I can say from the sentimental point of view, the unmet needs of the network. So, Ilaria, please, I give the floor to you for comments on this unmet needs paragraph, actually.
Thank you, Sarah. Yes, I must say we are very honored as EPAGs to have our unmet needs included in the state of the art of the clinical practice guidelines, because it was not explicitly mentioned in the articles that have been reviewed. We know that, as Antonio explained, I'm happy he mentioned namely Michela Onali, who is a very good patient advocate, that are usually included today, even more than in the past, and even less in a tokenism way. We were asked to develop a chapter explicitly on our community unmet needs. Of course, we didn't want to give only our point of view. We went out to our community through our federations or patient organizations, asking them to provide the unmet needs. It was a very good and important exercise, because what came out is that there are still different unmet needs from country to country. And let me say then I guess Sarah will talk about the adaptive. And this is important to highlight the geographical, economical differences. So we had this great opportunity. You can read them on our website, ReCONNET website. Thank you, Sarah.
Thank you to you, Ilaria. And after considering these unmet needs, and I should say that the whole network, learned a lot from these unmet needs and this specific paragraph, since these unmet needs represent what we have to do in the next years in ReCONNET, and as well as in other networks, since we have to highlight, and it is not obvious, that ERN have been launched for promoting equity of care. And this is why the European reference networks in general love a lot clinical practice guidelines, since they represent the tool for try to improve the equity of care, especially in the different countries. For this reason, we tried to check and assess not only the unmet needs by clinicians and patients, but also the real applicability, the adherence of clinical practice guidelines in real life. This both from the point of view of clinicians, but also from the point of view of patients. And when we checked again the second year of work of our ReCONNET ERN, the adherence of clinical practice guidelines, and in the community of patients, families, and caregivers, the knowledge and level of awareness in our rare and complex connective tissue disease, what we highlighted from the feedback is that from the clinicians' HCP point of view, obviously clinical practice guidelines are very, very important. But unfortunately, there are in some cases local legislative restrictions, and in many cases also time limitations in their applicability. So one of the main unmet needs for clinicians was represented by the need of having an easier and more practical version of clinical practice guidelines. And from the feedback by patients, an important message was to the need to have a patient-friendly version of clinical practice guidelines, not only in general, but specifically also on other items and domains, such as lifestyle guidelines. So we summarized, obviously, this data in a paper published in ERN Open, and it was very important since sharing the experience on a community of clinicians and patients in talk about the real adherence in clinical practice guidelines of guidelines is very important. Otherwise, clinical practice guidelines have no sense in their applicability. After that, we tried, and we are trying to integrate the network in the development of new clinical practice guidelines. This is, for example, the clinical practice guidelines developed on Sjögren's syndrome in the EULAR community. EULAR is the scientific society, obviously, and these recommendations include also an acknowledgement and a sort of partnership, even not formal, with ReCONNET. But we have other proposal for new recommendation. For example, there is an important proposal about the therapeutic approach on the rare manifestation of lupus from Laurent Arnaud and Chiara Tani, and we will work about that as network with the expertise of the clinicians, methodologies, but mainly patients. It is really, really important. Another important topic in our approach on clinical practice guidelines is to consider, in any case, lay version. Obviously, it is something already considered by scientific society. For example, EULAR Society consider lay version of many recommendations, but for a ERN is a sort of duty to disseminate something very important for clinicians and for patients community. This is why we started the work on systemic sclerosis, and on our website you can find the lay version of systemic sclerosis, and we are working on other disease, lupus and other rare disease. It is very, very important, since something lay version of clinical practice guidelines are important in order to be disseminated. Otherwise, it's not a real work. And I give the floor again to Ilaria for a brief comment about that.
Thank you, Sarah. Yes, we have developed with the systemic sclerosis a methodology on how to develop the lay versions that will be followed by other diseases. We are going to finalize lupus and EDS lay versions. We have worked very, very closely with our disease coordinators, because they had always to ensure that no scientific information would got lost, and everything reported in the layman version was real scientific validated. Then we also decided to change the order of the chapter based on the interest for patients. So instead of leaving the lung involvement or the digital ulcers involvement maybe in the middle, we put them first because it is there that the patient need and want to find useful information. And then we made a little bit interactive the website version, and we developed with the clinicians a dictionary to explain those scientific terms that can't be translated in a lay language within such a piece of work, but anyway need to be explained to empower patients also to make shared decision with their clinicians. So it was a very good exercise, but useful, because the feedback from our community was excellent. And let me say, Sarah, that our work on the state of the art has been acknowledged and keep on being acknowledged, because every week we receive in our inbox how many sites are done of this work. So no publication around lupus or antiphospholipid syndrome can avoid mentioning these works. Thank you.
Thank you, Ilaria. Thank you. And obviously, this is important for all the ERN. It is, and again, it is not so obvious. It is very, very important to disseminate the clinical practice guidelines or clinical decision-making tools that we have, since disseminating this tool is important to promote equity of care, especially for rare disease, for disease of scarce knowledge in many cases, and with different expertise in different countries. And this is important for all the websites of all the ERN, and this is our example for the different diseases. It is important also to promote educational activity for patients and caregivers for clinical practice guidance. This is what we did together with Ilaria, a webinar on try to explain what clinical practice guidelines are and why we need clinical practice guidelines, new clinical practice guidelines, and the adaptation in a framework of the ERN. Another important topic is the adaptation, the need for adaptation of clinical practice guidelines. As already said, we have a lot of clinical practice guidance for some connective tissue disease, especially for the complex rare disease. So we discussed a lot in the first years of our network in order to perform this methodology, the adaptation. We already discussed about the adapt process, but what is important from the point of view of the network is to prioritize the needs of the clinicians and patients. And the framework of the ERN in general is perfect in order to give the priority of needs. This is not it does not mean to change a clinical practice guidelines, but just to take advantage of the existing guidelines in order to ensure that we may disseminate recommendation for specific health question, for specific disease or a group of disease in the context of the different countries. And for example, in our framework, we identified the need for the adaptation for 4 diseases. The disease actually in which we have clinical practice guidance: lupus, systemic sclerosis, myositis, and Sjögren's syndrome. And we try to define 15 health questions, for example, which is the best treatment, which is the best approach for an early diagnosis. And it is very important since, yes, we have clinical practice guidelines, but we have to make a priority order of these needs. And the ADAPT process, in very simple words, means to give priorities. And we may disseminate in a very easier way an adaptation priorities in the different countries rather than clinical practice guidelines when they are not really applied. But obviously, clinical practice guidelines are the most important thing. Another important aspect, and it is for all the network, all the ERN, and we are lucky that we have the contractor supporting us in producing clinical practice guidance or clinical decision-making tools. In each ERN, there is the possibility to create an expert panel of clinicians and patients in order to interact with the contractor, but it is really important in order to promote new activity. Very few words regarding an approach that we created in the framework of the ERN. It is called RERN Path, just to say that this approach is important, is an approach aimed at promoting reference model for organization point of view of patients' care pathways. Well, it is very, very important since improving organizational patients' care pathway, we may really apply clinical practice guidelines. This is why I've had this comment in this summary. And just to finish, we have a lot of new proposals for clinical practice guidelines. And in many cases, we know that when the evidence is scarce, we have to consider and we launched this initiative in 2 months ago regarding the approach for our patients with antiviral therapies and antibody products for COVID, and they are points to consider, not clinical practice guide, not recommendation, since the clinical questions are really clinical question coming from the real life, from problems that as clinicians and patients we experience every day from the COVID pandemic. And the problem is the lacking homogeneous approach on antiviral therapy, antibody products for SARS-CoV-2 in all the patients, in the different regions of Italy, in the different regions of different countries. And we are finalized together with the IPAG and together with the clinicians volunteer to be part of this project points to consider. So we have a lot of work on clinical practice guidelines. And in order to do this work, with the heart, but also with the methodology, it is important to manage all the work. And it's important to have a vision in highlighting the real unmet needs of a ERN community. And for this reason, I give the floor to Diana in order to summarize our approach about that. Thank you.
Thank you so much, Sara and Ilaria. Just a few words to introduce from the management point of view. Our approach to guidelines that is always directed from the unmet needs of our community. And what you have seen today is really the pathway that we follow as a network, in which we try to join forces to address the unmet needs. And as you know, the unmet needs can be addressed in different ways. And what we have proposed to you today is to share our experience regarding what we are doing in not only in guidelines, but also, as you have seen, in other related tools such as pathways. So really our presentation was to let you know how a network can join forces and be guided by the unmet needs that are both from the clinicians, the patients, and other stakeholders' point of view, in order to improve the care, the diagnosis, and many other aspects of our diseases. And from a management point of view, I have to say that it is really important not only to be knowledgeable on the methodology and on the aspects, but also to ensure that everything that the network does is really addressing those unmet needs. And on the other side, we also have to be flexible, as for example, Sarah showed these recommendations were actually a product of both a clinician and a patient proposing the need to develop these recommendations. So we also need to be flexible and to ensure that if there is an emerging unmet need that has to be addressed, also the network has to adapt to these new needs and develop new projects.